Namaskar everyone, good evening. Today we are on the 30th of September evening. Generally on Friday evenings 8 to 9 p.m. Mentorship Trader Community members, we all join. We talk about the market. हम लोग market के बारे में discuss करते हैं. Last एक हफ्ते में market में क्या हुआ, कैसे सौदे किए, which are the ones, the trades that went right and wrong, क्या strategy होना चाहिए next week के लिए. So we talk about this every Friday. And that is one very important point about the Mentorship Traders Community members. But today evening, it's a little different one. As you can see on my screen, it says health is your wealth. And this is a very simple cliche line. सबको पता है ये, मतलब सबको पता है ये sentence. But इस sentence के पीछे का जो meaning है, probably सब उतनी अच्छी तरह से उसको महसूस या they don't understand the value of what health can be. So before I start, I would like to share a recent experience of mine. You know me, those who know me closely, of course, you know, but I'll just share a little bit about myself. I'm 42 years old, and I have been into technical analysis as a subject, technical trading as an associate, as a research guy, as a fund manager, etc., for last almost 18 years. Since 2005, I've been working on a computer, on a laptop, a compact laptop. And it's been my passion throughout. 3 months back, three and a half months back, around 12:30 midnight, I all of a sudden had a chest pain. Now, 12:30 at night, 40 years and above, if you get a chest pain, you tend to get worried. And so I was. Thankfully, it was not like an extreme chest pain that you will panic and you will rush to the hospital or that, but I just wanted to figure out that is it some kind of an acid reflux? It happened 3 nights, and I wanted to get the necessary tests done, checks done, the echo, the ECG, etc. And all the tests were fine, but still the pain was there. And so I would like to share a couple of tests, only one test, which the doctor suggested that I should get a X-ray of my cervical spine. And if you can see here, it says that straightening of the cervical spine likely due to muscular spasm. Now, I've been a fairly active guy on and off the market. Off the market after 3:30, I generally like to do some kind of a physical activity. It can be going to the gym or going out for a walk or run, whatever. So I take, it's not that I'm a fitness freak, but I like to sweat out. I like to work out physically. It just gives me a good, positive feeling overall. And see, I'm not blaming myself, but last few years, especially COVID के time से, आपने कितने सारे stories सुने होंगे, news सुने होंगे that a young guy, 35 or even not even 40, and all of a sudden they pass away. So there is somewhere back of our mind wo dar rehta hai. So as we conduct this evening, this webinar in front of you, I'm completely fine. I have no cardiac issues. It was due to a muscular spasm on the left hand side. Physiotherapy thoda bahut kiya tha, and this entire process, I'm extremely grateful. I'll take this opportunity to thank you, Dr. Pratap, because I was continuously in touch with him, and he shared his entire unbiased opinion so that I don't panic, so that I don't rush myself to an hospital and unnecessary get some treatment done, which is not needed. So it was nothing to do with my heart or the condition of my heart. It was got to do with something else. And my physiotherapist and Dr. Pratap and others also told me this can be high chance. It can be primarily because of posture. And I can understand because 18 years, we've been looking at a laptop, right? A little bent. Nowadays, you add the smartphone also. So most of the time, we're like this, most of the time. So posture plays an important role. Health plays an important role. So that's why I thought I'll conduct this webinar with everyone so that we learn from my experience and what both Dr. Pratap and Dr. Vinod has to say. So I welcome both Dr. Vinod and Dr. Pratap. If you can switch on your mics, and if we can see you, it will be really good. Good evening.
Good evening.
Dr. Pratap, thank you for joining in.
Good evening.
Thank you. I will share a bit of Dr. Vinod. Dr. Vinod is As you can see right in front of me, I have his website in front of us, cancerclinicpune.com. But I will not take the liberty to talk about them myself. I'll request Dr. Vinod first to briefly just share a bit about himself, his career, so that we resonate with you better.
Good evening, everybody. Good evening, sir. Actually, I'm a cancer surgeon. I'm practicing in Pune at Sahyadri Hospital since last 12 years. I have completed my training in the cancer surgery from Tata Memorial Hospital, Mumbai. And after that, I'm practicing cancer surgery. Apart from that, I have one hospital in Pune. And I'm also a director of Sai Nuclear Private Limited, which is a radio diagnostic company. So I'm working in various medical fields. Apart from that, actually, I came to know about the trading and this investing during the COVID time. Actually, one of our community member, Dr. Niman Tharale, introduced me to Mentorship Trader, and I'm lucky to have a mentor like Abhijit sir. Then Pratap is my very close friend, and after that he also joined the Mentorship Trader. We'll have the introduction of the Dr. Pratap, and then we will discuss regarding the our experience regarding what we have, what problems one trader can have regarding the health. So over to you, Pratap.
Yes, Dr.
Thanks.
Pratap.
Thank you for those kind words, Abhijit sir. And let me introduce myself. I am an internal medicine guy. I passed out in 2001, and then 2004 I started my hospital in a rental place, and then got into my own building where I run my Meenakshi Multi-Speciality Hospital at a district place around 100 kilometers from Pune. And since I was born and brought up in Mumbai, everybody was surprised. But let me tell you, it was my father who told me that if you go to a district place, your place in Mumbai is not going to go anywhere. And you would really enjoy your stay in district place, as well as you will have a lot to do. Since it was my passion to run a hospital, I started my small setup around 30 beds with 10-bedded ICU. And somehow I have had an opportunity to serve such a large cross-section of the society that I've been amongst the poorest and the elitist of the society. And in this journey of mine, there have been many instances where at the end of around 20-25 years of your private practice, you tend to know what exactly is happening into the medical practice of changing eras. And what I see largely is, on one hand, there is a lot of misunderstandings about these increasing incidences of life-threatening diseases. And on the other hand, people are worried about what will happen to them and how much they will have to spend. So practically, every person is now kind of trapped into a situation where he or she wants to be healthy, but has a conflicting suggestions about how to achieve it. Regarding my achievements, I have been awarded by many awards, which I would not like to enlist. But recently in COVID, I was awarded one of the best doctors in my part of the state by the Honorable Governor and the Health Minister of the state, which I think was a little too much. But it was one of the milestone, you could say. And I believe that as long as the family physician remains honest and very compassionate towards his care, he can do wonders. Thank you.
Thank you, Dr. Pratap. In fact, we are very lucky. When mentorship community is extremely lucky to have Dr. Vinod, Dr. Pratap, and many others. And I can confess something, that few years back when I was designing the program, when I thought that there's merit in it, there was one thing that I always kept back of my mind is to create a community. So I am not 100% sure that everyone would have made money from what I have taught, because making money from the market is different from concepts. But I really feel proud that I've managed to create a community which is so rich. So thank you. Let's start. Let's start with Dr. Pratap first. डॉक्टर प्रताप, आप मेरे साथ इस लास्ट 3-4 महीने का जो मेरा एक अजीबो गरीब टाइम था, when I say अजीबो गरीब, it was more in terms of I wanted to know what was going wrong, and of course there was a bit of fear. I will not hesitate from that. I want to ask you कि अगर कोई मेरे एज का 40+, I'm 42 as I told you, वो कभी भी काम करते हुए while working or while lying down in his day-to-day life, if he feels some kind of an uncomfortable state around the chest, everyone tends to panic, especially like for my case, it was happening at 12:30 at night. So please walk us through what are the key things that someone should keep in mind, and when he or she should not panic. We would like to know that whether to panic or not to, like when to hit the call that I need serious care.
Okay. Let me tell you in short what is the pathogenesis of having a serious cardiac trouble. First and foremost, everybody should remember that sudden cardiac event is something which is imaginary. That means because we haven't evaluated point-wise whether a particular individual is likely to have a myocardial infarction or a serious cardiac trouble, or he or she is unlikely to have some. It is very difficult for him or her to ascertain whether he or she needs to panic or not. First, understand that coronary artery disease, which inculcates into myocardial infarction or heart attack, is not something which happens in a matter of days, hours, or weeks. The atherosclerosis, which is a process by virtue of which the supplying channels to the heart are narrowed, is a process which everybody starts at birth and is called as atherosclerosis. So forget that the event can occur in a matter of minutes, but the process does not. Obviously, what does it implicate? It implicates that before one has a serious cardiac trouble, he or she needs to have a process in place which could lead to myocardial infarction or heart attack. Now, how do you evaluate that whether you are likely to have a heart condition or not? One, whether there is somebody who is your near first degree relative, like your father, your mother, your grandmother or grandfather, your siblings, who have had a history of sudden death. Now that is a first checkpoint, whether you have had this kind of history or not. And let me tell you, this is one of the most important determinant of having a cardiac trouble. So once you have nullified that, then here on, the things are modifiable. You or me cannot change our genetic history or the history of our siblings, but there are certain factors which are thought to be related to have an increased incidence of having a heart problem, which can always be modified. Now, as we all are aware, what are these modifiable factors? One is inactivity. That means somebody who is not making any activity during the daytime or during his routine schedule. Now, there is a lot of confusion regarding how much is required and how much is enough. Like you must have heard of so many stories where a very healthy man, a very fitness freak, has got into a cardiac trouble. So let me put it to you in a very clear term. How much is that is to be prescribed and is backed by almost every body which governs these guidelines throughout the world. If an individual does a walk for 75 minutes in a day, minimum 5 days a week, and not more than 6 days a week, that will minimize any chances of he or she getting into a serious cardiac trouble, unless they already have an underlying disease, which is like if somebody has a congenital valvular disease or a congenital heart abnormality. But for an individual to stay fit, as far as the cardiac fitness is concerned, 75 minutes of a walk, 5 days is enough to make you fit. Now, in this, please remember that it has no relation to the distance that you cover or the speed at which you would cover the distance. So don't freak out that I have to complete 10 kilometers in 75 minutes, or I have to be at a pace of 6 minutes per kilometer. It's not required. It's not healthy. In the long run, after 35, 40, this is not going to work for you unless you want to do it for a short while. Like you have a marathon coming up and you want to exercise for that, it's all right. But if you want to take it to 75, 80, if you just remember this, this is more than enough. Now, there are other things, like people say that if you are a diabetic, you are more likely to develop heart complications. If you have a hypertension, that is commonly known as blood pressure problem, you are more likely to have myocardial infarction or heart attack. Yes, to an extent, this is absolutely true. But there are 2 or 3 confusing things. First confusion: how do you say that you are diabetic or not, and what are the levels which are desirable? If your blood sugar level fasting is less than 130, and after dinner or after lunch, if it is less than 180, do not panic. You may first address it by lifestyle modification, dietary control, and you will be absolutely fine. So just because you have been labeled a diabetic, don't think that you have a far more chance, as is projected in the common knowledge, that you have 5 times chance of a heart attack. If you are a hypertensive, you are 10 times. It is not put in paper. Don't panic. You need to worry, but worry is different absolutely than panic. So now you come to second point, that diabetes and hypertension, yes, you need to be on a lookout, but just because you have them does not make you more likely to have a heart attack, but more vulnerable. That's all. Now, the third thing is, what should you eat and what should you not? Just avoiding all sorts of sugar is more than enough. There is also a misconception that if you eat a lot of fats, as long as you eat healthy fat, don't worry about your cholesterol unless they are alarmingly high. But if you go to visit any cardiac care unit and just look at their lipid profiles, you would understand that many are lying there with absolutely normal lipid profile and they have got into a heart trouble, and many have abnormal, but that does not mean that they have a different or more serious kind of a heart trouble. So then what is that is still not allowing even developed countries like USA not reducing their cardiac mortality? The only factor which is universal and more worrisome is that there is a stress which is neither accepted, not measurable, and is present almost in everyone. It is like a ubiquitous common stress that we see all along our life and is the major risk factor. Let me clear one more thing about blood pressure. See, I see and I so many times regret that whenever people are diagnosed with hypertension, let me put it straight. What is hypertension? If your readings while you are sitting, while you are standing, and while you are sleeping, if you take an average, and if what is called as systolic BP, that is a higher side of BP, is more than 135, and diastolic, which is on the lower side, it is more than 85, then you may have a mild hypertension. If these levels are more than 140 by 90, you do have one. If you have more than 150 by 100, yes, you need to take medication for that. Now, many people that I see get into this trouble of having the complications early in their life because they are not ready to accept and address these issues in the beginning. Let me tell you a fact. Majority of life-threatening complications set in the first 5 years of occurrence of the disease. That means if somebody's blood pressure is today 135 by 85 and more, and he or she decides that मैं तो tablet लूंगा ही नहीं, मुझे तो hypertension है ही नहीं, वो reading गलत था. Boss, where the science works beautifully is if you start now. There is no point in putting up a couple of cardiac stents when the complications have already set in. A beauty of a medical science is not allowing you to reach a stage where you may land up in an emergency. So please, whenever you see that, yes, there is a hypertension, there is nothing more than a tablet that you need to take. And if you take it as soon as it is diagnosed, take my word for it that your chances of getting into a serious trouble would go down by almost 80 to 90%. So don't fight if you are diagnosed with hypertension or diabetes. These are, in a strict terms, not diseases. These are just findings which are making you aware that if you live with them for more than 5 years, you have already set a path to have some complications in the future. Instead of that, just a single tablet while you go to bed will make everything that is necessary and not put you through these misery of running around in the hospital and getting yourself tested multiple times. So this is a confusion that I thought, and I tell every patient of mine that, boss, there is nothing to worry about, but there is something that you should actively do. As I understand of life, it's all about the time frame. If I don't do anything now, and then if I panic in future or regret that I should have done, it has no meaning seriously. So these are 2-3 things. Apart from this, yes, smoking is one of the contributor for ischemic heart disease. Alcohol, yes. Lack of sleep, more than yes. Very bad kind of a diet that you take and which is not a timely diet. Yes, it is one of the major things that can disturb your metabolism. And in addition to that, if you have a fixed metabolic disease like thyroid disorder, like rheumatoid arthritis, like scleroderma, these can, or the medications which are used for these can increase your chances of having a heart disease. Now I think I have covered what could lead to heart disease, which is the first part of it. Then comes the real answer to your question, when to push a panic button. Now let me tell you, heart attacks would usually occur at the end of the stress. The chest pain that one gets when he or she gets a heart attack is the worst chest pain that they have ever witnessed. It is like a feeling of compression in the retrosternal area. So if you have a pain here, if you have a pain here, if you have a pain in the back, if you have a pain on the right side, and if it increases by movement, by taking a deep breath and relieves on itself without putting any medicine into yourself, is unlikely to be a cardiac pain. A pain that does not increase while you're walking, does not get worse while you're walking, does not lead to breathlessness when you are trying to actively do something, does not make you feel that you're short of breath, is unlikely to be a cardiac pain. Now, how do you really assess? I always tell all my families to have three wonder drugs in their house. One is aspirin, which is around 325 milligrams, four tablets of clopidogrel, each tablet of around 75 milligram, constituting around 300 milligram of clopidogrel and 80 milligram of atorvastatin. And if or your family member has a tendency to be developing acidity, then a simple tablet like rabeprazole or domperidone or pantoprazole or domperidone. If you have a strip of these drugs, I'll tell you, you would do more good to the patient than anybody who is going to do what they do post angiography, that is thrombolysis. In first 30 minutes, if you could just administer these four drugs, then you are almost, saving a patient by almost 30 to 40% on the spot. And this is applicable whether a person has had a heart attack or has had a stroke, that is called as paralysis. Because these are the drugs, no sooner than the time that they are ingested, usually we ask our patients to crush these tablets with their teeth so that the absorption is sublingual and not from the gastric tract. Faster effect is seen. And if you do this, and now you want to go to a hospital and get an ECG done, whether the ECG reveals that there is a cardiac problem or it does not reveal that there is a cardiac problem, it is not going to make any difference. But before you start, press the panic button, evaluate, see for yourself whether you are likely to have a heart attack. If you feel that you are in doubt, which you should not be, if your answers to the previous questions are an absolute no, then don't panic. Consult your doctor. Nowadays, we have certain watches where you can do a ECG, but that's a single lead ECG. So I will not ask you to rely on it. What I advise my patients is you do a mock drill. That means what I do is if I'm approached by a young couple, I'll ask them how many elderlies are staying with you. And if they are, and if they have certain diseases, I'll ask them to do a mock drill. That imagine that in the midnight around 2 o'clock, if your father-in-law or if your father develops something like a slurring of speech and is not able to sit up, and you think that he or she has had a paralysis, what will you do? Who will you call? What ambulance is available at 2 a.m. at morning, and which hospital has a facility to treat them at the middle of the night? If you have everything in place, then you are not to worry. Just make a call, go to the hospital and get your ECG done. If ECG is fine, and if your doctor thinks that there is a necessity to stay there for say 2 to 6 hours, stay in the hospital. Don't panic. At the end of 6 hours, your cardiac enzymes will be there, your serial ECGs will be there, you will be declared as non-cardiac chest pain and you'll be left home. Because there have been instances where people have left the hospital and have had a problem at the end of 2 hours, 4 hours, or 6 hours. Because a ECG is an instant report and cardiac situations do develop dynamically. So we may have heard so many stories where the person had walked in as an absolute normal day and fell down and his autopsy report showed that he has had a myocardial infarction. But that does not necessitize us to panic that every chest pain is cardiac chest pain. So now if you have time and see these recordings later on, you will realize that the position is clear, the nature is clear, the factors which increase it and the factors which do not when it is cardiac, not non-cardiac pain is very clear in your mind. Now you also have been equipped with what you are going to do even in the worst case. So now you are protected. Now you know which ambulance to call. I think this will give you not only a stability in handling such emergency, but also confidence that nothing is going to happen to you. Now, I think that is a complete answer to your question, Abhijit sir.
Thank you, and more than complete. In fact, I like the fact कि आपने बताया that you should do a drill. जैसे fire drill होता है कि अगर fire हो तो how should we behave? उसका एक drill होना चाहिए because we don't want to panic. Because I think most of the damage will be done when someone hits the panic button. और वो अपने को stock market में भी दिखता है. The biggest crash always comes when people are in a panic and they sell, and वो 2 दिन बाद ही दिखता है price फिर से ऊपर चला गया. But talking about markets and doctors, I think Dr. Vinod is a very interesting example with us, because we know he's a cancer expert, and we also know that he trades. Now, he knows the do's and don'ts as a doctor. Means from the health point of view, उनको पता है कि क्या करना चाहिए, क्या नहीं करना चाहिए. Number one. And क्योंकि वो already trading कर रहे हैं and he's been in the market, he has also experienced the stress that comes from the fluctuations of the market. So, Dr. Vinod, I would want to ask you that you, of course, hopefully heard us throughout what Dr. Pratap suggested to us, and you heard what I had gone through. Anything that you would like to add to this? One. Number two, as a doctor who knows the do's and don'ts of the health and as a trade trader, what are your key learnings that you have kind of implemented in your life, and you would like others who are in a different profession and side by side they might be doing some kind of trading also? So how do you juggle this well? And if you can add something more to what this discussion so far has gone through.
Yeah, thank you. Actually, Dr. Pratap has explained it very well. And मैं आपको और एक चीज बताना चाहता हूँ कि Pratap is actually founder and director of Satara Hill Marathon. Satara Hill Marathon is one of the prestigious marathon in the world. It comes in first 5 or 7 prestigious marathons of the world, and it is really a beautiful marathon. Actually, I also participated twice, and the nature and everything is very nice at Satara. So it is really a beautiful, and it is started by Pratap and his friends. So now coming to our question, actually trading में जो problems आते हैं, actually trading comes with some cost. बहुत बार हमने ये when I started the trading, when COVID time में मैंने बहुत सारे YouTube videos देखे थे, बहुत लोगों को सुना था, तो everybody was telling कि बहुत सारे लोगों ने ये बताया है कि बहुत सारे ऐसे लोग हैं जो अपने जॉब से छुटकारा पाना चाहते हैं. They want free time, they want to enjoy their life, and they don't want anybody's bossing. Many reasons are there, but क्या trading really ये सब चीजें अचीव करने में हमें help करती है या नहीं? And it is not very easy. You can achieve all these things, but it is not easy. We have to keep the balance. Okay. Now, so which are the things, our costs of the trading? हम एक point उस पर discuss करेंगे. First thing is posture. अभी ट्रेडिंग में क्या है ना कि हम दिन भर एक जगह पे बैठते हैं. Actually, I am not a full-time trader. Like I can imagine the people who can sit from 9 to 3:30 on the computer and continuously doing the day trading. वो लोगों को posture जो है उनका, so they are continuously sitting. There is no back support many times, and usually this is the most common factor or most common problem of the trader, that they have some back pain, muscle spasm, ये सब चीजें होती रहती. So we have to take care that our posture while doing the trading is good. कभी कभी स्क्रीन का जो पोजीशन है वो ठीक नहीं होता है. अपना स्क्रीन का पोजीशन अच्छी तरह से होना चाहिए. दूसरी बात, बहुत बार सी टू इट की व्हाट कॉजेस द मोस्ट पेन. क्या है ना, कंटिन्यूअसली हम कोई भी जब बैठते हैं 4-5 घंटों के लिए, तो बैक पेन तो हर एक को होता है, लेकिन ऐसा कौन सा चीज है, बहुत बार ऐसा होता है कि इफ आई स्टडी ऑन माई पर्टिकुलर टेबल, एक्चुअली मैंने एक चेयर लिया जो बहुत अच्छा चेयर है 15-20 हजार का, लेकिन वो चेयर पे मैं जब भी बैठता हूँ ना मुझे बैक एक, तो मैं एक सिंपल चेयर लेके बैठता हूँ. तो व्हाट आई हैव फाउंड कि वो चेयर पे मैं जब भी बैठता हूँ 2 घंटों के लिए, देन आई गेट बैक, because the design of that chair, though it looks beautiful, it is not suitable for me. So you find out which chair is suitable for you. दूसरी बात यह है कि आप जब ट्रेडिंग करते हैं तो कंटिन्यूअसली आपको बैठना नहीं है, बीच बीच में आपको थोड़ा यू हैव टू मूव, यू हैव टू वॉक, यू कैन हैव 5 minutes वॉक, डोंट सिट कंटिन्यूअसली, सो यू शुड हैव ब्रेक्स. थर्ड थिंग, कंटिन्यूअसली सिटिंग से और एक प्रॉब्लम होता है, उसको डेप वेन थ्रोम्बोसिस बोलते हैं. जो हमारे वेन्स रहते हैं पैर के, उसमें कभी कभी थ्रोम्बोसिस होता है या गुठली होती है. सो वो थ्रोम्बोसिस के कारण it is a life threatening condition. Sometimes those blood clots, if they comes from the leg to the heart or your pulmonary veins, it causes heart attack. So वो भी एक चीज है कि कंटिन्यूअसली आपको बैठना नहीं है. आप जितना स्टैग्नेंट बैठोगे, आपका ब्लड फ्लो उतना स्टैग्नेट होगा और वो डीबीटी के चांसेस आप में बढ़ेंगे. तीसरी चीज है, आप कंटिन्यूअसली बैठेंगे तो मसल स्पाज्म में जाएंगे. So in between you should have a stretchings. So these are all problems related to posture. Third thing, which is very very common in traders, is stress on the eyes. ये तो बहुत बार आप लोग तो डे ट्रेडर जो हो, आप बड़े स्क्रीन पे देखते हो. हम लोग तो काम करते हैं, तो काम करते वक्त we see most of the time in mobile. So even I have experienced personally that I have lot of stress if I see in the mobile continuously. I see the chart in very small phone. So don't see the charts in small devices like phones or iPads. So use the larger screen, or you can use the specs. You can use the specs, और वो अल्ट्रा वायलेट लाइट और वो सब चीजें तो बाकी की है, ब्राइटनेस की वजह से जो आपके आंखों को तकलीफ होती है वो. So these are the related with posture. Now coming to the schedule. अभी I have practically traded in the market. So as I said कि बहुत बार ऐसा लगता है बहुत लोगों की कि अरे मार्केट में पैसा कमाएंगे तो बहुत सारा फ्रीडम आएगा, ये आएगा. तो यूजुअली ये ट्रेडर का शेड्यूल क्या होता है, एंड आई हैव रियलाइज्ड दैट अनलेस यू स्टडी हार्ड यू विल नॉट गेट मनी. द अमाउंट ऑफ मनी यू गेट is directly proportional to your hard work you are putting, your study, and market is dynamic. It doesn't move with one thing. So आपको फंडामेंटल भी देखना है, आपको टेक्निकल भी देखना है, आपको न्यूज भी देखना है. तो व्हाट इज द यूजुअल शेड्यूल ऑफ द ट्रेडर? 9 to 3 जो लोग डे ट्रेडिंग करते हैं, 9 to 3 वो कंसोल पे बैठते हैं. उसके बाद 7 बजे दे विल सी कि एफआई का डाटा क्या गया, डीआई का डाटा क्या गया, एसजीएक्स निफ्टी कहाँ तक गया है. देन दे विल स्टडी द चार्ट, they will study the OI data, then they will open the sensible, they will see the कि कॉल कहाँ कम हुए, पुट कहाँ कम हुए. ये सब चीजें वो सब रात को 7 बजे से लेके 10 बजे तक, 10:30 बजे तक चलती है. Then you start seeing the SGX Nifty at 10:30, 11, or even if you get some आप नींद से कभी जग जाते हो तो 2 बजे भी आप देखोगे कि SGX निफ्टी कहाँ है, कल क्या होने वाला है, मेरी इतनी पोजीशन मार्केट में है. फिर सुबह आप जब उठते हो तो अगेन यू विल स्टार्ट सीइंग द SGX निफ्टी. फिर आपको ग्लोबल न्यूज देखने हैं कि आज क्या हो गया, रशिया में क्या हुआ, यूक्रेन में क्या हुआ, पावेल ने क्या बोल दिया. तो यू सी द न्यूज ऑन द टेलीविजन, यू सी द मनी कंट्रोल न्यूज. तो ये सब चीजें, सो यू आर कंटिन्यूअसली एंगेज yourself. So freedom कहाँ से आ जाए? You are not giving time to your family, you are not giving time to your health, you are not giving time for your hobby, you are not giving time to your children, and you are not giving time to yourself. तो आपको ये देखना है कि जिस चीज के लिए आपने ट्रेडिंग चालू किया था क्या वो अचीव हो रहा है. So you have to make the balance between all these things. आपने बहुत लोगों ने देखा रहेगा कि बहुत लोग बोलते हैं अरे आपने ट्रेडिंग जब से चालू किया ना, आप लोगों में है ही नहीं, आप ना फैमिली के लिए टाइम दे रहे हो, ना आप कहीं घूमने जा रहे हो. यू आर कंटिन्यूअसली वॉचिंग दैट फोन, एंड फोन पे कंटिन्यूअसली आप देखते हो कि अरे मार्केट कहाँ गया, मार्केट ऊपर गया, मार्केट नीचे गया. तो नाउ इट इज वेरी डिफिकल्ट टू बैलेंस दिस, बट somehow we have to balance this. Third thing is psychology. This is a very important point. Actually, I will discuss this point, and again we will come back to Pratap, because Pratap can add more things because actually I'm a cancer surgeon. Whatever I'm telling is just from my experience and experience of my friends. Now, even ये जो schedule है ना, इसमें the people who are working like me, मैं डॉक्टर हूँ या फिर कोई इंजीनियर है, तो उन लोगों में भी क्या होता है ना, continuously during the working hours also, you are looking in that phone. You are continuously seeing the phone. आपके पोजीशन का क्या हुआ, कितना प्रॉफिट हुआ, कितना लॉस हुआ, अभी मार्केट ऊपर जा रहा है, नीचे जा रहा है, क्या हो रहा है. सो ऑल दिस थिंग्स ऑब्वियसली कोई भी ऐसा बताए ना कि मैं नहीं देखूंगा, इट इज इम्पॉसिबल. आपका ध्यान उधर जाएगा ही, थोड़ा तो जाए. आप काम में भी हो गए ना, तो आपके 5 पोजीशन मार्केट में है, तो आपको वो टेंशन रहता है कि अरे अभी गिर गया तो मेरा पोजीशन का क्या होगा. सो ऑल दिस थिंग्स will be definitely there, and we have to find out the ways to this. Third, coming to the psychology and stress. अभी मार्केट में आप हो तो स्ट्रेस अपने आप आ जाता है. स्ट्रेस ऑफ लॉसेस, दैट इज स्ट्रेस ऑफ लूजिंग द मनी. देयर इज अ स्ट्रेस ऑफ लूजिंग अपॉर्चुनिटी. बहुत बार ऐसा होता है, आज आरबीआई की पॉलिसी आ गई, मार्केट 2% ऊपर गया और मैंने तो कल ही पोजीशन क्लोज कर दिए थे मेरे, सो आई हैव लॉस्ट द अपॉर्चुनिटी. तो वो टेंशन रहता है. मार्केट क्रैश हो गया, 18,000 से 17,000 हो गया, मेरे 25 पोजीशन थे तो मेरे लॉसेस आ गए, तो वो टेंशन रहता है. देन अगेन द पीपल हु आर पुटिंग स्टॉप लॉसेस, मार्केट वोलेटाइल रहता है, तो स्ट्रेस ऑफ गेटिंग स्टॉप्ड आउट इज आल्सो देयर. एंड ड्यू टू स्ट्रेस few people smoke and they take alcohol. So again this will add fuel to the fire. तो आपको स्ट्रेस है which is increasing your chances of heart attack, and उसके ऊपर because of stress few people are smoking and drinking, that will add more risk and more chances for the heart attack. Now even the alcohol log even they enjoy, or if they get the good profits also they will take alcohol. So in both the condition in market, alcohol is a friend of trader, or many traders. I can say not everybody, but many traders of trades. So how can avoid this stress? Are there ways? So we have to work on this. Can we avoid this stress of trading? There is always a stress of trade. और इससे भी इंटरेस्टिंग मैं बात बताता हूं आपको कि इससे भी एक खराब बीमारी है कि किसी को स्ट्रेस ही नहीं आता. मेरी वाइफ मुझे कभी कभी बोलती है, अरे 15 लाख लॉसेस दिख रहे हैं अनरियलाइज और तुमको स्ट्रेस नहीं आता है. सो दिस इज आल्सो वेरी बैड थिंग कि आपको लॉसेस दिख रहे हैं, यू हैव बिकम टू इम्यून टू द लॉसेस दैट यू आर नॉट गेटिंग एनी स्ट्रेस. दैट इज अ वर्स्ट थिंग टू हैव. सो आपको ये कैसे बैलेंस करना है? आपको स्ट्रेस भी नहीं लेना है और ऐसा भी नहीं होना है कि आप एकदम इम्यून बन गए एंड यू आर जस्ट लूजिंग द मनी और आपको कुछ भी नहीं लग रहा है, तो ऐसा भी नहीं होना चाहिए. सो वी हैव टू मेक द बैलेंस, एंड दैट इज द क्रक्स ऑफ द स्टोरी, दैट वी हैव टू फाइंड सम वे. एंड आई थॉट अबाउट इट, I many times discussed with Abhijit sir also. So few of the ways are position sizing. You should take less positions. Second thing is you should put your strict stop losses, that even if the market falls, you will get some small losses. And third thing is investing into the best. Investing is the best option to this, according to me, because even the stop losses. See, there are two systems which I follow. One thing is which Abhijit sir has taught, put your stop losses, take stop losses and trade. So I follow that system also, and sometimes I take position without stop losses. So there are pros and cons of both the systems. Stop losses system also gives stress because many times you are stopped out, so wo bhi ek stress rehta hai. And not putting stop loss also gives some stress whenever market crashes, because it bleeds very heavy. So investing is one best option. What I have found is Abhijit sir's investing strategy, that buy on the dips using that RSI 3. That is the best strategy, because what has happened, because I am doing investing also and I am doing trading also. So what I have realized, investing never gave me any stress. Because क्या होता है कि जब मार्केट गिरता है, whenever market falls, I am happy that I am getting the opportunity to invest at lower level. So आई एम ऑलवेज हैप्पी. मार्केट जब ऊपर जाता है तो मुझे लगता है अरे मेरा नीचे के लेवल पे इन्वेस्टिंग हो गया, अभी मेरा इन्वेस्टिंग का वैल्यू बढ़ गया, तो अगेन आई एम हैप्पी. So usually I don't get depressed whenever market falls or market goes up. So investing is one option, and let me tell you, even Abhijit sir will agree. Investing also sometimes, if you done properly and if you follow the search system properly, it can give many times better return than trading. Because many times आपको लगता है ट्रेडिंग में बहुत सारे पैसे बहुत कम टाइम में मिले, लेकिन उतने पैसे जाते भी. So many times that system investing gives you better return. And उसके बाद अभी इन्वेस्टिंग तो है, लेकिन ट्रेडिंग के लिए आई विल रिक्वेस्ट अभिजीत सर, आप ऐसा कुछ फाइंड आउट करो कि जिससे हम ट्रेडिंग कर सके विदाउट एनी स्ट्रेस, विदाउट एनी ऐसा डिस्टर्बेंस फ्रॉम द वर्क, कि ट्रेडिंग में पोजीशन ले लिया, हम आराम से बैठे और पोजीशन नीचे गया ऊपर गया उसका ज्यादा कुछ स्ट्रेस ना लगे. I know it is very difficult to find out such trading system, but the work you are doing, you are definitely having that capabilities, and I am sure one day he will come with the system that can trading system that can give us the less stress, and we can trade even with the small time in the market. Because what I have realized, even in the trading or investing, we should give limited time to the market, and remaining time you should spend for your family, your children, yourself, your health. And actually we are learning from these mistakes. So everybody of us is making mistake, and we should learn. And this is good that we are discussing today about this, about our mistakes, and we'll definitely come to some conclusion or some positive points through this discussion. So thank you, sir. So you can add.
Yeah. Thank you, Dr. Vinod. Now I would request Dr. Pratap to also join in, because I'm going to ask both of you few do's and don'ts, and I will put them in like simple, to the point, one sentence, nothing more than a sentence, do's and don'ts. So this will be primarily, iska source is primarily from the point of view for health. Just say, for example, don't smoke and drink too much. Okay. Do's, take 10,000 steps a day. Try to take 10,000 steps a day for at least five days a week. That is it. So a do, which will be like one small sentence, a don't in one small sentence. So a do's and don'ts from both your sides, starting with Dr. Pratap. We will have maybe 2 or 3 rounds of these do's and don'ts. So अगर आपके पास 3 do's है, so वो 3 बार में हम आपसे सुनेंगे एक-एक करके. So Dr. Pratap, to you first, one do and one don't.
Drink 10 to 12 glasses of water at any cost. And if you are living in a area where it gets too hot during the summer, increase it to 14 glasses of water. This is an absolute must, because I truly believe that water is the easiest and cheapest medicine created by God for everyone. Don'ts. Do not deprive yourself of sleep less than 7 hours under any circumstances, especially due to any stress related to your conditions in the market.
Dr. Pratap, क्या मैं आपको एक क्वेश्चन पूछ सकता हूँ?
जी सर.
Is quality of sleep and quantity of sleep matters here? Because मैंने personally मेरे साथ ये देखा है कि at times just 4 या 5 या 6 घंटे of sleep, I am extremely energized and I don't need any sleep. And ऐसे भी दिन हुए कि मैं 9 घंटे तक सोया हूँ, या 9 घंटा ज्यादा बोल गया, let's say 8 घंटे तक सोया हूँ, but I still feel afternoon को I am feeling low on energy. So the energy and sleep, I feel personal, I'm not a doctor of course, is completely a personal opinion. मैंने देखा है कि quality of sleep is more important than the amount of sleep. How much?
Yes, sir. Now there are two things. Scientifically, yes, the quality, which is measured by how many hours of your sleep are spent in a deep sleep, are directly proportional to how well you feel when you open your eyes. So there is no argument about it. What you have put as your personal experience is absolutely backed by the science. Now, what is the reality? Ideally, a person should sleep or divide his or her day into two compartments. If you can manage to sleep during the daytime, just like if we are talking about a trader, then at the end of your 3:30, 4 o'clock, if you could catch a nap for 45 minutes, I'll tell you, you will rejoice it. Because it's like an exhausted runner who sits for a while and then probably he feels the most energized. So from 8:30 to 3:30, you have exhausted every possible neuronal circuit in your brain. You go to sleep, don't oversleep because that might kill your sleep in the night. But 45 minutes to 1 hour of sleep, if you could catch up, that is the best thing to happen. And regarding how well can you sleep, now there are two, three things. If you are sedentary, then you tend to sleep in a disturbed way. Then, if you have something in your mind which you take on while you go to sleep, that leads to a bad quality of sleep.
Okay.
So, while you go to sleep, if you thank the Lord that this is an interval at the end of which I may not wake up, because death is nothing but an extended sleep.
True.
So, or the sleep is nothing but a snapshot of what happens to your body. I think the duration is important because you grow during the sleep, you heal during the sleep. So if you pile on these 4 hours of refreshing sleep at the end of the day, at the end of week or a month, you might not be able to heal yourself. That's the science behind the duration, and the quality is unquestionable.
Great. Thank you. Thank you, Dr. Pratap. Dr. Vinod, one do and one don't.
Yeah, do not sit at a place for more than 1 hour continuously. You should have some walk in between.
Dr. Vinod, I'll ask you a small question.
Yeah.
Thanks to this recent episode at my end, I have made a couple of changes. One, I have shifted to a standing desk. आपको समझ में आ रहा होगा कि I'm standing right now as I conduct the webinar. So I have, I don't know, but the standing thing makes me mix between standing, walking, taking a short walk, and sitting. ऐसा नहीं है कि मैं पूरा 7 घंटा I'm standing. I'm balanced between standing and sitting. So, do you suggest that standing can be useful? This is my personal thing that I'm doing, but is there any kind of study or anything that standing desk can help?
Yeah, standing continuously also will create more stress on your back. So it should be the combination of standing, sitting, walking. So you can combine this. That is the best option.
Okay.
So not having the same posture continuously is the key. So what you are doing is right.
The mix.
But don't stand continuously for 1 hour, 2 hours. Because many times even I have seen कि जब मार्केट गिरता है या मार्केट बहुत ऊपर जाता है ना, when we are excited, that time also we are continuously standing and doing the trading. That also causes lot of stress on your back. So it is okay if you are standing and in between you are moving. Yeah.
So essentially a mix. मतलब किसी भी एक particular posture पे, stance पे don't stay for an extended span of time. Bottom line.
Yeah.
Okay. One do from your side.
Use large screens and use glasses if you are having any eye problems.
Okay. Okay. Coming to Dr. Pratap, sir, one more do's and don't, please.
Annual checkup for yourself and a spouse. You may pick up any date, any festival, or your birthday or year end. And once you have crossed 40, do make it a point that from a reputed lab, you get yourself screened once. And once in a life, get your 2D echocardiography done just to rule out any structural abnormality so that it does not come up in later findings. So that is a do.
Okay, thank you. Don't.
Don't hold up, whether it is an urge to eat, urge to sleep, urge to enjoy, or urge to just relax. Don't hold up. Live your life.
Very nice. Very nice. Dr. Vinod, आपके पास.
Yeah. Don't smoke and don't drink. Or if you are drinking, drink in small quantity.
Mm-hmm. Okay.
Yeah, obviously, drink lot of water, and do give lot of time to your family, lot of time to yourself. And if you are having stress, you should have some meditation. So do the meditation at least for 15 minutes a day, or if you can do more, it is good. Meditation means it's not only the chanting Om or something. Meditation can be hobby also. Playing some instrument is also sort of meditation. So if you are involving, whatever gives you pleasure or whatever distract you from trading and all this stress is a meditation. So you should do the meditation, or you should do the things which you will enjoy.
Perfect, sir. Wonderful, wonderful. I would, Dr. Pratap, as I told you, ये last 3-4 महीने में I was in constant touch with him and he guided me a lot. And we spoke, we discussed multiple things. And one thing he told me, मुझे अभी भी याद है phone पे, he was telling me that आप 18 साल से, for 18 years I've been looking at a computer laptop like this. For a market person like me or any IT person will also resonate with this kind of a state. तो उन्होंने एक चीज बताया कि आपको देख के लगता है कि आप थोड़ा बहुत वर्कआउट करते हो and you are physically also active. तो मैंने बताया कि yes, I like that. It's not that I'm a freak and I want 6 packs. वैसा कुछ नहीं है. It's just that मुझे दिन में at least 30 minutes to 1 hour, if I do anything which brings a little sweat, it makes me feel happy. तो उन्होंने मुझे एक चीज बताया, he told me over the phone that thankfully you did this, or else this kind of a muscle spasm or straightening of the cervical spine or this kind of an outcome that you have gone through, ये बहुत पहले हो सकता था अगर आप ऐसा लाइफस्टाइल नहीं लीड करते. तो I want to take this sentence of his words to share with everyone that bring in some kind of a physical activity. It can be the best thing is a walk. I think that is the easiest, free of cost. You can just step out and आपके घर के आसपास अगर कोई park, lake है तो beautiful. अगर नहीं भी है, I would rather go outdoor and walk rather than walking on a treadmill, because treadmill end of it वो कोने में पड़ा ही रहता है. So a little bit of physical activity, and from my side, I think food also plays a very important role. So I'll take the last, feedback suggestion for you. This that मुझे ऐसा लगता है nutrition, food, how important it is, not only from a trader's point of view, not only from a stress point of view, not only from cardiac point of view, but overall lifestyle के लिए, how important is food from a doctor's point of view?
Most important, because food actually reflects what you put in your vehicle. So whether it is going to run long, whether it is going to run fast, and whether it is going to bump and you are going to hit a wall is completely dependent on what you consume. Now there is a lot of confusion. So let me first clear that if you just drop sugar from your life, from your food, from your diet, you are doing a most wonderful thing that you could have done to yourself, especially if you have crossed 40 years of life. Okay. So before 40, I think we should allow a certain amount of sweets, but post 40, if you just do this one thing, I think that would do wonders. Second suggestion, don't be cholesterol phobic. One of the most energy efficient food comes from good source oil. The confusion that the fraternity has created around cholesterol, oil, and fatty acids is an absolute wrong thing to understand. Because if you take healthy oil inside you, your brain functions better. Most of the vitamins are fat soluble vitamins, which are required for any intellectual activity. Your bones and joints would do wonderfully well if you have enough good, healthy fatty acids.
Right.
And if you have dropped sugar, it's not going to cause any amount of weight gain. So don't worry about it. And cholesterol does not clog your arteries. It is the atherosclerosis which is bound to occur that clogs your arteries. Now, second thing is timing of the food. Please make sure that you do not eat and go to bed. You have early dinners so that you spend around 2 to 3 hours doing something and then you go to bed. Regarding kind of food that everybody wants to eat, it largely depends in a cross section of India whether you stay. So whatever a simple suggestion is, try to follow what your grandfather ate or your grandmother ate. That's the best thing to eat, and it is for all practical purposes most healthy too.
Correct. Apna desi diet, desi ghee, in time, less quantity, I think would be better after sunset to eat. I think will be a better suggestion to make. All right, we have some questions. Isko quickly le lete. We have Rajesh ji, who's appreciating that we have taken a different route today and organized such a nice webinar. Ayush is asking, is there any natural way to control my dopamine, testosterone level while trading or throughout the day? Natural way to control my dopamine and testosterone. I cannot think of a way.
Natural ways to practice pranayama.
Okay.
If you do not want to resort to drugs,
right.
The most natural way of controlling your hormonal shoots is to practice pranayama.
And
if you practice your pulse and if it remains below 60 for all the time, I think you have controlled your hormones.
A couple of questions. The heartbeat rate that we see in most of our watches nowadays, is it different from the pulse that the doctors used to check early days with their 3 fingers? Is there any difference count wise?
Yes, there is a margin of error, and it is getting better day by day, getting more accurate. But obviously, if you are running or if you are in a physical activity, there could be a little lag. If you are sitting quietly, then the reading will be more right. But they are getting better at it as we get acquainted with the technology. And it is so simple for everybody to take a pulse. Just practice this, and that is more than enough. And I think that should help once you get used to it. And if you have a stopwatch, you could calculate your pulse.
So the count less than 60 means you're
doing great.
You're doing good. And Dr. Pratap, also with age, these testosterone and other hormones also drops with age, as we age, as the entire machine ages. So
aging is biological, so one should not worry about it. And as long as you are following a healthy lifestyle and a good diet, the hormones don't die away soon. So don't take yourself as an old unless your body tells you so.
Right.
And if hormones are completely dependent, they are an interplay of mind and your brain. So if you are into yoga and if you meditate, I think they would remain in balance. They should not overshoot.
I completely agree with you. Karan is saying that when I recommend any trade, I share कि अगर ये trade गलत जाता है तो आपको कितना loss हो सकता है. वो कितना लॉस हो सकता है पहले जानना, बिफोर आई टेक द ट्रेड, मुझे पता है कि इस ट्रेड में मुझे 10,000 या 20,000 का लॉस हो सकता है. दैट एक्चुअली हेल्प्स अ लॉट बिकॉज समवेयर द ब्रेन नोज कितना लॉस हो सकता है. तो एक्चुअली जब वो लॉस होता है, दिखता है 5, 7, 8 करके, कि समवेयर you have kind of managed to prepare yourself to handle that loss. I think that is what he is sharing with us. Ayush is saying that, Vijit sir, how do you look so younger than your age? Please share this PPT. Of course, I will share the PPT. इसीलिए ये PPT बनाया ना. How do I look so young? I don't know, but I can share with you few things that I do very religiously with myself. Number one is food. I eat a very small breakfast, not very small, but a decent breakfast, a very natural breakfast like sprouts and nuts and coconut water kind of things. The first thing in the morning that I eat are all natural, very less cooked things, not cooked at all. Then I eat a lunch early by noon, 12:30. I eat a lunch which is a proper Bengali lunch with rice and fish. I like the rice, dal, and fish. And dinner is always extremely light, like a soup, or that's it, maybe soup and a salad, that's it. By 7, 7:30, I'm done. So most of the Friday evenings when we conduct our classes, my dinner is done. I generally love to take my dinners, and this is something that I've been doing. I drink 1 cup of coffee after breakfast. I make my coffee myself. I get the beans, I crush the beans, I pour the water. I enjoy that. 15 minutes is my meditation, my yoga. I just enjoy making my coffee. And I drink 1 cup of tea in the afternoon around 3:30. So I think this kind of, it is not strict. As I said, I kind of like doing it. I also eat junk food. I eat fuchka. I eat biryani once in a while. It's not that nahi mujhe nahi khana hai. I like eating sweets, but of course not hog into them once in a while. So I don't stop my brain from saying कि मुझे 26 साल एक भी काजू कतली मैंने नहीं खाया. I'm not that kind of a fitness freak. So I will let my body enjoy everything, but in a restricted, balanced way. And I think अगर ये I think this has worked for me. Apart from that, I like to work out. जैसे मैंने बताया. Vishal is saying, sir hits the gym 6 days a week and lifts heavy. No, I do not lift heavy. In fact, आजकल मैं हमारे जो अखाड़ा स्टाइल के जो वर्कआउट्स होते हैं, करला कटाई या जो जिसको आप हिंदू क्लब्स बोलते हो, ऐसे घुमाना. So I'm more into desi workouts nowadays. बैठक मारना and all that, push up, Hindu dons and all that. So I don't lift heavy, not at all. And I don't hit the gym 6 days a week. I go 3 to 4 days. That's it. Ayan is saying, I've kept my laptops on night mode every time. My room's light are set on warm, while white to reduce blue lights. I've read somewhere that blue lights reduce melatonin, which causes sleep. Can you add something on this? So I'll repeat Ayan's question so that both Dr. Vinod and Pratap can hear it. He's saying that he's on the night mode in the evenings, and I've read somewhere that blue lights reduce melatonin, which causes sleep. Can you add something on this? So he's essentially question about the impact of lights in the evening and the quality of sleep with that. Dr. Vinod, would like to add something on this?
Yeah, actually, as I said earlier, this screen time definitely have an impact on your vision also, and your sleep also, your stress levels. All these things are related with your screen time. So one thing is you have to try to reduce the screen time. Second thing is you should reduce the brightness, but it should not be very dim also. Otherwise, it will cause more stress. And we should prevent the blue light, because blue light causes more damage to your vision as well as your increases the stress, and it can disturb the sleep.
Dr. Pratap?
Yeah, there has been extensive research on this thing post humans starting to use all these lights and devices. And it clearly shows that what it does is it confuses the sleep center in your brain. Because humans have been trained and they have adopted light to awakening. If you are looking at your screen after say 8 o'clock, 9 o'clock in the night, then your brain has reached that confused state whether it is not able to differentiate whether it is day or night. And that makes the whole sleep pattern go haywire. So that's the most important thing. Apart from that, as has been elaborated by Dr. Vinod, yes, it causes more damage to the posterior segment of your eye, especially the retina, if you have been extendedly looking at the screen. So, but the most important thing is this brain confusion that it
Yeah.
causes, and one should absolutely avoid it.
Okay.
And many times you might have realized that you are feeling sleepy at 9 o'clock. Then we watch the movie or a cricket match till 2 o'clock, and after that you don't get sleep because your brain is now thinking that the day is started. So that is the reason for that confusion.
Right, right. I'll share a couple of things. Again, my sharing is completely experiential. One, I completely try not to try, no, I make it a very strong point not to drink tea, coffee, or eat any kind of chocolate after it is sunset. I've noticed that if I drink tea, coffee, especially coffee, it affects the sleep. We can understand that caffeine. And number two thing that I personally have noticed that I generally prefer to sleep by between 9:30 to 10:30, 10:30 max. If any day I'm working or doing something which I want to finish and then hit the bed, and if it's, let's say, even 11:15 or 11:30, I've noticed my quality of sleep is not that good. Maybe my body has got, there's a body clock, of course. So I think the takeaway that I have here is create a body clock of yourself. And if you have a more or less and fixed time to go to sleep and fixed time to get up, I think your body will adjust to your behavior, your habits better. That's what I have realized. Now, let's take the last question and we'll sign off. Vishal is saying that my heart rate reaches around 100 plus while sitting when my position goes wrong, but other time it is absolutely normal. Should I worry about this? Please suggest. I mean, position taken in the market. So I'll take up this question. So Vishal, your heart rate will only go up to 100 and shoot off away from 100 and more because you have taken a position which you are not able to handle. It's like driving a Maruti car or driving a Bugatti, which can run at 300 kilometers per hour. You can't handle it, right? Or let's say, let's not go to Bugatti. Will you be able to drive a Formula One and F1 car? No, because you have not readied yourself to run that car. You know how to drive an 800 or 1000 or a 1200 cc car. It's simple. Are you able to handle that vehicle or not? So the position that you're taking, and if it's causing that kind of a heart rate and you're fairly uncomfortable, means you're doing something which psychologically and physiologically you're not ready to handle. The way to deal with this is reduce the size of your trade, start with as small as possible and scale up rather than starting with that. And this is the only way. The second way is, no, sir, I'm at the minimal size. Still, I'm feeling this. Then this is little difficult. Then you have to talk yourself out. You need to talk to yourself or figure out how I can make myself more capable जिससे कि मैं इसको handle कर पाऊँ. अगर फिर भी आप देखते हो that it is repetitive, then maybe you give good second thought. कि trading को बहुत कम रख के you focus more on medium term to long term investments. Is there anyone who would like to voice out any question to Dr. Vinod or Pratap?
Hi, good evening, sir.
Good evening.
Good evening.
Good evening.
Sir, जो आपने 4 वंडर मेडिसिन्स बोली हैं वो काइंडली पीपीटी में मेंशन कर देंगे प्लीज.
जी मैं सर से बात करूंगा.
हाँ, these will be something which will go into the prescription kind of line. So we will discuss. And Ankit, right?
Yes, sir.
Yes, Ankit.
Good evening, sir.
Will share with you. Good evening.
Yeah,
Right.
I would like to add one thing which actually we missed. Apart from all the points you told in the diet, one more thing is very important. Usually the trader sits on the system throughout the day, right? So they don't go out, and usually they are having vitamin D deficiency or iron deficiency many times.
Yes.
So even in the case of Abhijit sir, the main reason was that vitamin D deficiency. So we get vitamin D through the sunlight and from the food also. But many times even we don't get adequate amount of vitamin D and iron from the food. And many times we need supplements in the form of tablets. So many times you should check your vitamin D and maybe without checking also, you can take vitamin D tablets maybe for a month in a year.
Right, right. In fact, the doctor has prescribed me to take one vitamin D tablet once in a week for a month. And I think Dr. Pratap's suggestion that especially if you're 40 plus, आप साल में एक बार पूरी तरह से thorough checkup कीजिए. I think that is the right time. You check all the necessary, vitamin D test. I think you should do there as well. But sunlight, I completely agree with you. Sunlight, not only from, I think, vitamin D point of view, but it makes you feel a different person. It makes you feel very alive. I completely agree. All right. Thank you, Dr. Pratap. Thank you, Dr. Vinod. You've been great help. Abhi to Satara aana hi hai. And hopefully go out for a run with you. Dr. Vinod, thank you. Thanks a lot. Thank you, everyone, for joining.
Thank you, sir.
And we'll catch up again on Monday morning. Thank you. Enjoy your weekend.
Thank you, sir.
Good night.
Thank you and good night. Have a great week.